You're listening to The Pelvic Messenger, hosted by Dr. Amy Stein and Dr. Corey Hazama. Presented by Beyond Basics Physical Therapy.
Hi, I'm Dr. Hazama. I'm a pelvic floor physical therapist and one of the co-founders for our office in the downtown area of Manhattan called Beyond Basics. And today we are chatting with Dr. Joshua Gonzalez about Shattering the Stigma, a candid conversation about men's sexual health. So thank you for being here with us today. For those of you who don't know you, which I find very hard to believe, can you tell us a little bit about yourself, your personal journey through medical school, specializing in urology, sexual medicine, and what led you to launch your practice?
Yeah, sure. So thank you first for having me on. I am a urologist, specializing in sexual medicine. And I'm in practice in Los Angeles. In terms of my journey on how I got here, it's been a long road. I just realized the other day that I've been in practice for 10 years, which is really crazy. But I did my medical school training at Columbia in New York, and then that was followed by my urology residency, also in New York City at Mount Sinai. So I'm very familiar with New York, and love traveling back there all the time. After my residency, I did a fellowship in sexual medicine for 1 year down in San Diego with Irwin Goldstein. And so since then, starting in 2015, I've been in practice by myself, solo private practice, and really have a special interest in and a primary focus in sexual health. So that's kind of my bread and butter and my passion.
So what is the most common sexual health concerns that men face?
So I see both men and women, but for men, I would say the big ones are obviously erectile dysfunction. Like 30 million men struggle with erectile dysfunction in this country. So it's not a surprise that would be one of kind of the big issues that we help treat. Other things that we see a lot of are things like low sexual desire. I treat a lot of men with chronic pelvic pain, which is why I have such a close relationship with a lot of pelvic floor physical therapists. We do a lot of hormonal management. So for men, that's testosterone replacement therapy a lot of times, or prescribed medications that help boost their natural production of testosterone. I do a little bit of male infertility, and then kind of a grab bag of a bunch of other stuff, including, Peyronie's disease. Let's see what else. Things like premature ejaculation, delayed ejaculation, orgasmic dysfunction. So kind of everything and anything related to sex.
So what are some of the psychological and physiological factors that interplay in the development of sexual health issues in men?
I mean, it can be complicated. So I always I always approach sexual dysfunction from kind of a social lens, right? So that means that we are trying to take into account biology, psychology, and the social situation in which someone is coming to see us, because all of those things we know can have an impact on sexual function. So I'm primarily looking at and evaluating and treating the biological aspects, but definitely like to touch on those other aspects and work with colleagues to help address other issues that come up in those areas outside of physiology. I would say from a biological or physiological standpoint, when you're talking about sexual function, it's really important to evaluate hormonal function. We do that, on the initial visit when we're meeting with somebody. Also, blood flow or vascular function is incredibly important, especially when you're talking about something like erectile function, right? The penis is a vascular organ. The erection occurs because of normal blood flow and normal hemodynamics. And so we do some, fairly sophisticated testing here, using a penile Doppler ultrasound to evaluate the blood flow of our male patients to see why they might be having problems with their erections. We often will try to do a preliminary assessment of pelvic floor function or dysfunction, because there, is a clear link for a lot of men between having pelvic floor dysfunction and sexual dysfunction. And then, there's not a lot of well-validated tests for neurological function, but we do try to assess, for things like sensation, or screen patients for concomitant like low back pain, because we do know that to have normal erectile function, you have to have an intact nervous system. And so that's something that we often evaluate too. When it comes to psychology, again, that's a little bit out of my wheelhouse, but I do often screen patients and ask them about, their mood. Do they have a history of depression and anxiety? Do they find that their sexual function seems to be related to how they're feeling mentally? Are they really stressed out? And is there a correlation between their function and their degree of stress and anxiety in their life? So that's kind of how I try to approach everybody. But it takes a while to evaluate all that stuff.
Yeah. No, I definitely agree with you. I mean, being a physical therapist, I'm also dealing more with like the mechanics,
Mm-hmm.
and it does get hard sometimes because there is so much overlap and overplay with psychological factors,
Mm-hmm.
the relationships that people are in, or what they're going through, or their beliefs, or obviously, what are your thoughts about like cultural or societal factors contributing to reluctance to discuss these issues?
Yeah, I mean, it's tough, right? Like if you see somebody that comes from a background that has a lot of shame around sex, or it is just I see some patients that have been in arranged marriages, and they come from backgrounds where sex is just not talked about, and so they're just poorly educated. They like literally don't know how to have sex. And so a lot of times it when I come across that, I will suggest that we add like a therapist to the team to help them kind of address some of those issues. But it can be challenging to break down, cultural beliefs around sex, and especially when you're talking about things like shame.
Yeah. No, and also like in this world today, there's just like there's so much stuff coming from outside. It's like, like porn is everywhere now, even just like, watching movies, and you're seeing how sex is portrayed on TV or movies, and you're like, oh, well, that's how it's supposed to go. And then when it doesn't go that way, then, it's easy to believe that like something must be wrong with you, or with how you're approaching it, or
Yeah. Totally.
do you see that aging has an impact on sexual health in men? I mean, I think that actually, like within my practice, I'm seeing mostly younger men actually. So it really has been kind of an interesting shift, and but again, I think age is something that people have concerns about. So do you have it?
Yeah. I mean, age is a risk factor for sure, right? But is it the chronological age specifically, or is it the things that happen as we age, right? So like I already alluded to the importance of vascular function, right? We know that vascular function deteriorates as men get older, right? So if you're having a decline in your cardiovascular function, one of the first things that you may notice is problems with your erections, because the blood vessels that supply the penis with blood during an erection are tiny, even in comparison to the vessels in our heart or in our brain. So you're much more likely as a man to present with erectile dysfunction as like an initial sign of cardiovascular disease, sometimes years before you would ever have like a heart attack or chest pain or a stroke. And so their age is definitely a factor. We do see an increase in certain sexual dysfunctions like erectile dysfunction with advanced age. The estimates are around 30% of men in their 30s, 40% of more men in their 40s, 50% of men in their 50s, and so on. It goes up by about 10% with each decade of life. But I think what you're kind of suggesting, and I think what's important for, listeners to understand, is that you can still have a problem even if you are a young person. It historically, we used to kind of write off younger men who had these conditions because we would assume, oh, you're too young to have this problem. And the reality is I'm in a similar boat as you. I see a lot of younger patients who have problems and have been told a lot of times by other providers that there's no way they could possibly have, a physical problem because they're too young to have that. And that's just not true.
So speaking about like age being a risk factor, I'm sorry, I'm going off script here a little bit, but I'm gonna think of something.
I love it.
Right.
I love it.
So do you have any suggestions? Because I can imagine, someone who's aging or concerned about like, oh my gosh, it's gonna happen to me. I'm getting older. What are just some life changes you would recommend right away to maybe start off some of these changes?
Yeah, I mean, that's a good question. Because I get asked, I mean, I live in Los Angeles, you are in New York, like people in these cities, especially in LA, really value like, longevity and taking care of themselves and, all that kind of stuff. So I wish I could like point to specific large clinical trials that have looked at behavioral changes and shown a positive impact on sexual function. Those unfortunately don't really exist. But in general, what we do is we counsel patients to think of their sexual health as just a microcosm of their overall health, right? So all of those things that your doctor tells you to do, to stay healthy, right? And to support cardiovascular function, things like, exercising regularly. So I tell patients a lot of times, shoot for 3 to 4 times a day, at least 30 minutes. You want a good mix of cardiovascular exercise and strength training, right? Sleeping well, shooting to get 6 to 8 hours of sleep a night. Sleep is really, really important for hormonal function. Eating a well-balanced, heart-healthy diet. One of the specific diets that has been looked at in men is the Mediterranean diet. And so I will often recommend that for my patients who are looking to do whatever they can from a lifestyle standpoint to support, their hormonal and sexual function. So those are kind of like the big ones. But I think in general, telling people and encouraging people to be proactive about their sexual health in the same way that they ideally should be for their overall health, is the best thing to do, right? So don't necessarily wait till you have a problem. You should be seeing someone about your sexual health, like looking for ways to optimize it before it's problematic. That's my opinion. So yeah, that's kind of how I approach it.
So why is there so much stigma surrounding men's sexual health?
I mean, that's a good question. I think, first of all, I would argue that there's more stigma around female sexual health, but I do recognize stigma around men's sexual health. Because I think there's just a stigma about sex in general, right? In our society, there's this like weird dynamic between us being constantly inundated, and you said this a minute ago, with sexual imagery and media, right? So like there's not just porn, but like think about like popular media, lyrics in popular songs, film and television, and the representation of sex in those mediums, right? Like we're constantly inundated by sexual imagery, and media. And at the same time, we don't really educate people on what sex should be, could be, and specifically around, we're not having conversations around pleasure, right? All of the education that you and I got when we were younger is really about how do you prevent sexually transmitted infections and how do you prevent pregnancy. There's never a conversation about like how to have good sex or how to, figure out what is pleasurable to you and then communicate that to a partner so that you can have, create intimacy and have a more fulfilling sex life with that person. So, I would just say that the stigma around male sexual health is just a component of how we view sex in general, unfortunately, in this country.
I mean, I definitely think that there's been an uptick in just general knowledge. Because, I mean, I see Peroni's ads now on TV. They have, like, hymns. So it's, like, it's getting out there. But what would your advice for, to give to a man who is maybe hesitant to seek out help for his sexual health issues?
Yeah, I mean, I think you're right. I mean, I think it's definitely moving in the right direction. And I think with the advent of things like social media, that's been very helpful for people to find answers or at least find communities online of other people that may be dealing with the same things. Unfortunately, that also comes with a lot of misinformation. But I do think it can be a positive thing for people, especially if they are sort of living in shame because of the problem that they're having, to be able to identify other people online that may be having the same issue. So, I would say to someone who's having a problem, I would tell them that there are providers out there like myself that focus specifically on sex, and that they should do their research, look for providers in their area. I'm part of a couple of organizations, the Sexual Medicine Society of North America, and the International Society for the Study of Women's Sexual Health, both of which have provider, databases where you can search by your location and find providers who specialize in both male sexual health and female sexual health, or in my case, both. And, if you are running into some sort of resistance, or sort of medical gaslighting about an issue that you're dealing with from a provider who may not have the education necessary to help you with your problem, then look elsewhere. Go online, do some of your own research. Be careful with that research, because again, there is a lot of misinformation out there, but ideally find a provider who has a background in sexual health, just to, have a proper evaluation.
Yeah, no, you make a really good point. Because not all urologists understand or deal with sexual health. So
That's right. Yeah.
So yeah, I think it's really
I mean, it's kind of a travesty. Like, urologists are poorly educated about male sexual health. I would argue that gynecologists are poorly educated about female sexual health. And so, you have, as a provider, and this is, I'm not trying to disparage urologists and gynecologists by any means, because it's not their fault. It's the fault of the education system that we come up in, right? There's very little discussion or emphasis on sex in medical education in general. And then once you further, move down the path and you decide on a residency, you would think that would be built into urology and gynecology residency training programs. And I think you're starting to see a little bit of a shift to where there's more of an emphasis put on that. But 10 years ago, when I finished training, my urology residency focused on cancer, pediatrics, incontinence, and that was kind of it. There was, and sort of bread and butter, benign general urology. We had very little education in male sexual function. And I know, having talked to gynecology colleagues of mine, that's pretty true for gynecology as well. Their focus is on obstetrics, treating gynecological cancers, and and benign gynecological issues that they run into. There's very little education on sexual health. So I think you're right. I don't think it's enough to just assume that your regular urologist or your regular gynecologist is going to be well educated in sexual health.
Yeah, I recall there was I feel like there's an article or something that came out, and it was saying that most people want their doctors to ask them about how their sex life is, because they're not going to volunteer it. So with that thought, what are some of your suggestions maybe to healthcare providers to better support men in addressing their concerns?
I think we have to shift how we think about it, right? So as a primary care provider, and listen, they have a lot of things to talk about, right? They've got to go over medications and talk about age appropriate screening and blood pressure and screen people for diabetes. And there's a lot that has to be covered. But I think, and maybe this doesn't happen at every visit, but I think if you're doing an intake on a person and you're meeting them for the first time, it should be a subcategory of things that you go through, right? You ask about family history, you ask about surgical history, you ask about medical history, you ask about medications and allergies. And you do this whole review of systems and a comprehensive physical exam. I think that sexual health and sexual history should be a component of a comprehensive medical evaluation, because it is a microcosm of your overall health, right? So it should be built into and come as naturally in that initial intake, and just be another thing. If we're asking people about whether they smoke cigarettes and drink alcohol, we should be asking them about what's going on with their sex life, right? In my opinion. So I think, the onus is really on provider to build that into their workflow and to shift how they think about sexual health and not think that it's like prying or too personal, because you can gain a lot of information about someone's health by asking about their sexual health, right? Like you may be seeing a 50-year-old guy who has no medical history. You wouldn't think that he has underlying cardiovascular disease, and you ask him about his erections, and he's like, oh, I've noticed my erections have been, declining over the last few years. That might be the first sign of underlying cardiovascular disease that would otherwise not get picked up. So if you kind of shift how you think about it, I think it makes a lot of sense.
Yeah, no, I started out as an orthopedic physical therapist, and like we never talked about like what went on below the belt. Like we never did.
Yeah.
So to pelvic health, and all of a sudden like having to learn how to like comfortably ask these questions. It was a bit of a learning process, but then you actually get very comfortable with it.
Yeah.
So I do think there's like a lot of, especially the like younger PTs, like you're like, I don't know. Like I feel uncomfortable. I think it's, you can easily reflect that on your patient so that they feel uncomfortable.
Yeah. I think that speaks to what we were just talking about too, right? Like we all live in the same society. So I think if anything, like that discomfort that people experience, that the provider is experiencing, is a combination of not feeling like they have the words or the education maybe to ask the appropriate questions, and two, a certain sociocultural, discomfort about sex in general, right? Like, but as providers, I think we need to take some responsibility and understand that a lot of these patients are coming to us and putting themselves in a vulnerable state and looking to us for guidance. And so we have to be the ones that really break the ice here and ask that question, because as you mentioned, that's what patients want, but they're not necessarily going to say it. So, yeah.
So what are some of the most common myths that are in med sexual health that you come across?
Good question. I would say the first one is, that young men can't have a problem with sexual function. Kind of alluding to what I mentioned earlier. Sexual dysfunction can happen to someone at any age. So writing someone off because of their age is, in my opinion, incredibly harmful and will often set them back months to years before they actually find a solution for their issue. I would say from a patient standpoint, I get a lot of people who don't understand what erectile dysfunction is, right? Some of them will say, well, like I can get hard, but I have trouble maintaining my erection. But I don't think that's erectile dysfunction because I can get hard. The definition of erectile dysfunction is the ability to achieve and maintain an erection. So that's something I have to educate patients on a lot. I think there's a lot of misunderstanding about what a normal time frame to have sex is, right? So a lot of people, probably because of porn and popular media, think that, sex should be 10 minutes, 20 minutes, 45 minutes, an hour. Listen, that would be great. And if you can make that happen, good for you. And sometimes you can prolong sex if you're talking about that time, also incorporating foreplay. But the reality is that like the average time of sex in this country is about 5 to 7 minutes. And so if you are, if you're ejaculating at 6 minutes and you're coming to me thinking that you have premature ejaculation, we have to talk about what realistic, timeframes are. So I get that a lot as well.
How can men get accurate information and avoid falling for some of these misconceptions?
I would say try to find, reputable sources of information. As I mentioned earlier, like thankfully, a lot of people have resources online that they can go to and read about these things. I would stay out of forums like on Reddit and other places where people seem to just be like screaming at the sun about conditions that they're suffering from. I don't think that is helpful a lot of times for patients because it can create anxiety and that can, be counterproductive to fixing the problem that you're having. But if you're curious about or want to learn more about your particular sexual dysfunction, go to places of accurate information, Harvard's website, the Cleveland Clinic website, the societies that I mentioned earlier, the Sexual Medicine Society of North America, the International Society for the Study of Women's Sexual Health, all of these places have blogs and web pages full of information specifically about sex. And so going to one of those resources, I think, can be helpful, and don't necessarily put too much weight behind what you read on Reddit or Facebook or all these kinds of stuff, like because a lot of that stuff can be misinformed or clickbaity, like they're just trying to get eyeballs, so they're saying like extreme things. So I would try to rely on reliable forms of information.
Can you name anything like for somebody who's like, I just need to find a reputable source?
Yeah, so smsna.org is the Sexual Medicine Society of North America. They have a website and a newsletter that they will send out information about various sexual health topics. So I think that's a good resource for specifically men's sexual health to start with. That's what I would recommend.
Again, like, with all these misconceptions and, what we're seeing, bombarded with, is like...
Oh, and sorry, what? And go to my website. And they should go to my website, joshuagonzalezmd.com, because we have plenty of helpful information on there.
But is there like a standardized like test or something that someone could take to know, okay, maybe I need to go get this checked out, or, certainly I treat males and females as well, but, how many people have we talked to with female anatomy where they're like, oh, that was the first time I was supposed to hurt, and then like, hurts.
Yeah.
A little bit, that's normal. And it's like,
yeah,
not so much, but again, I think people don't know because they don't know what's like quote unquote normal.
Totally. Yeah, no, I mean, there's no standardized tests. That would be great, right? If all people, that test should be given like in elementary school or junior high, you know what I mean? But no, unfortunately, we do a poor job of educating kids, adolescents, and I would argue adults in this country about sex. But I would say, as a general rule, if you are not having pleasurable sex, not just like, oh, it doesn't hurt that bad, or, oh, it feels okay. But if you're not finding sex pleasurable, it might be worth looking into, right? Like, what's going on? There's a reason that people talk about sex a lot, and you hear about it feeling good all the time. So if you're not getting that feeling, then, do a little research, maybe talk to a provider and see what may be going on. It could be a mismatch with your partner, but also, we uncover things like you just suggested all the time, where you talk to a woman and they're like, well, she's really uncomfortable, I think that, and you're like, oh, well, that's not supposed to be like that. You know what I mean? And so I think, if you're not having pleasurable sex, then do something about it and look to see, investigate why that might be the case.
Right. Or something's particularly distressing to you. Like, even like, I have patients come in and say to me, like, I don't know if I've ever had an orgasm. Like, I'm supposed to see fire?
Yeah.
Like, just going into like explaining, like, actually what an orgasm is, it's a contraction of muscles happening, and that's what we find.
Right. Yeah.
We kind of like, again, like laying expectations. This is actually what's happening. The way people describe things may not necessarily be how you describe things. Certainly, like, this is a space where we can talk about those things and kind of make sure that we're understanding what you're distressed about.
Yeah.
So we talked about that one actually a little bit. So we talked about that one a little bit. Oh, we're doing great. Okay, so how can men effectively communicate with their partners about their sexual health issues?
I think it's, that's like an individualized thing. I would say, because I'm not in everybody's relationship. I think being honest and vulnerable, is like a good starting point. The problem is not everyone feels like they can be like that in their relationship. But, I always encourage people who I'm seeing or ask about whether or not they are they are sharing this, I always ask, I'm like, does your partner know that you're here? And, if they say no, I will often tell them like, listen, I think, sex is like a team sport here. You're not having sex by yourself. I mean, you can, but you're clearly here because you want to have sex with someone else. And if you're not involving them in the process, then the work that we're going to be doing together is not going to be as valuable, right? If they don't understand what is happening to you and what we're going to be doing together, they're going to feel, left in the dark. And also they may develop, and I've seen this happen before, right? Like guys who have ED, they'll come in sometimes and say like, oh, my partner thinks I'm not attracted to them.
Yeah.
But I am. Like, I want to have sex. I want to be able to like have a good erection. And so, if that person's not telling their partner, like, listen, I went to see Dr. Gonzalez and he found that I actually have a blood flow problem, but we're going to fix it. He's like helping me work on that. Then that person is left to just assume that it's because they're not, their partner's not attracted to them. You know what I mean? So I always try to encourage people to be honest and vulnerable with their partners. If somebody has like an underlying problem, and they had that problem before this relationship existed, it can be very difficult to open up about that. I don't think it's necessarily something that needs to come out on the first date, but if you're getting into this relationship and this is something that you want to continue, at whatever point you reach that conclusion, especially if you intend to have sex with this person, I think it's better to be open about these things before you try to have sex, because if the sex doesn't work out or is like, a flop, then that person is going to be like, well, what's going on? Is it me? Like, and so I think if you can be open and say like, listen, I've struggled with this issue for a long time, well before you. I just want to be open with you about it, and I hope that like that the care that I'm getting from my provider will make our sex life even better. You know what I mean? So I think leading with honesty is probably the most important thing.
Yeah, I think it's similar for like with PT. I have a lot of patients who come in and they're like, no, until this is fixed, I am not even entering, getting on the websites. I'm not doing it. So
I think also another like tip that I would tell people would be like bring them to your visit with me, right? Like a lot, if you don't feel comfortable or have the words to explain what is going on, or you feel like it's not going to be received well, because I had men tell me like, well, I don't really want to talk to my wife about it because she's going to think I'm like lying or making it up because she really thinks that it's because I'm not attracted to her or whatever. Then I'm like, bring her to the visit, because I'm your doctor and I'm telling you, you have a physical problem. So if she needs to hear it from me to understand and needs me to explain it to understand what's really going on here, then I'm happy to do that. You know what I mean? As long as they feel comfortable me chatting with her. But I think that takes the stress off of the patient, right? Because they can be like, all right, well, I'll have you talk to my partner about it. And they'll understand that this is not in my head and this is not a relationship issue that we're having. It's a physical problem,
What are some common causes of a lack of sexual desire in men? And what are some of the treatment options?
So desire is complicated. I would say that the things that are important to evaluate would definitely be hormonal function. Testosterone is a really important hormone for desire. There are some other hormones when they're kind of off that can negatively impact desire as well. So we do like a comprehensive hormonal assessment, usually at the patient's first visit. But libido is also, dependent on your mental health, your neurochemistry, your relationship, what is going on in the external world. So, stress and anxiety can have a negative impact on desire. Relationship issues can have a negative impact on desire. Erectile dysfunction can have a negative impact on desire. So we try to evaluate all of those things, right? If someone has low desire and they have ED, a lot of times if you improve their erections, their desire goes up. So we try to be comprehensive when evaluating people's desire, and the treatments can involve hormonal treatments, medicines that increase blood flow, or improve erectile function. We will put patients on medicines that can alter or shift the neurochemistry in their brain, especially if they've been on medications like SSRIs and antidepressants that have already done that. If it seems like it's a relationship issue, and I've run into this before with some of my patients, I encourage them to, if they're not already in therapy, to like seek out help from a therapist to try to work through those issues. And yeah, I mean, we just try to think of it like holistically. It's never, I wish there was like a magic libido pill that worked for everybody, but a lot of times it's sort of multifactorial.
Mm-hmm. Yeah, it's very complicated.
Yep.
So in regards to erectile dysfunction, what are some of the primary causes for that? Both like, mostly like physical, I think. Yeah.
So hormonal factors can definitely contribute, right? Like if someone has really low testosterone and they're presenting with erectile dysfunction, it's very likely that they're presenting with ED along with a bunch of other low T symptoms. But putting that person on a treatment that's going to raise their testosterone can have a positive impact on their erections. So I would say hormonal factors, vascular function. As I mentioned, we do like a vascular assessment to see what's going on with a person's blood flow. Neurological function. There is a lot of interest now in the relationship between the nervous system and sexual function in general, but the nerves that come from the spinal cord are really important for, signaling to the blood vessels to dilate or constrict. They're also important for innervating the penis and providing sensation. So making sure that is grossly intact can be important. I would say those are the three big ones. I don't know where you would put pelvic floor in there. I tend to think of it kind of as a subcategory of vascular, because I have seen a lot of patients who have a normal hemodynamic study in our office, but when we're doing the study, it is very obvious that they are clenching, and that muscle tension can intermittently disrupt what would otherwise be normal blood flow. So if I suspect that, I will often refer them to someone like you to work on that. So I would kind of put that as like a subcategory within the vascular.
Yeah, I mean, if someone's coming to me for sexual or like erection difficulty maintaining, that's usually what I tell them. I'm like, look, it's blood flow. It's all about blood flow, sexual function, getting erection, about blood flow, and the blood needs to get in and the blood needs to get out. And so a lot of your muscles are responsible for doing and helping with that. So if they're not functioning optimally, then like other parts of you're not going to function optimally. So when you say blood flow vascular, are you talking about like sclerosis, like arthrosclerosis, or like high blood pressure?
Yeah, I mean, high blood pressure is a risk factor for atherosclerosis, right? But we do these assessments on all types of men. We do them on men who have a history of hypertension and diabetes, which are known risk factors for atherosclerosis. But we also do them on young men who have no history of high blood pressure or any other cardiovascular dysfunction. But in terms of what is happening in the blood vessels, so there's sort of in the vessels that supply the penis with blood during an erection, there's two vascular functions that we're assessing for, right? To have a normal erection, you have to get blood into the penis quickly, and you also have to be able to trap the blood there. So we're assessing for two different things. The inflow, when patients have a problem getting blood in, that's called arterial insufficiency. And that can be from atherosclerosis, it can be from pelvic floor dysfunction, it can be from some sort of pelvic trauma that disrupted what would otherwise be normal inflow. That's a condition called cavernosal arterial insufficiency, right? The cavernosal artery that supplies blood is not getting the blood in quickly enough. And we measure that by measuring the velocity of blood going through that blood vessel at the time of their erection. That's just one thing, right? The other thing is you have to trap the blood there. And that is a unique property to the penis when it's erect, because normally, in all of our tissues in the body, right, you get blood in through an artery, it drops off the oxygen, it through the capillary, it picks up the waste and immediately circulates the blood out through the vein. In an erection, you get blood in and you need it to stay there for the 5 to 7 minutes that you're going to have sex. And then things reverse and the blood goes out. So men can have a trapping issue where the veins in their penis don't get completely compressed and some of them remain patent and open and the blood leaks out. And that's a condition called venous leak. So when we're evaluating somebody in our office when they're erect, you should be able to measure the blood going in and not see any movement of blood during the venous phase. That would be a normal study. But if the velocity of blood going in through the artery is lower than what we have determined as the cutoff for normal blood flow, and then that person would have arterial insufficiency. And if there's movement of blood during the venous phase, that would indicate venous leak. So men can have arterial insufficiency, they can have venous leak, or they can have both.
So in regards to what can cause orgasms to happen too slowly or too quickly?
Orgasm or ejaculation? Because those are two different things.
Let's say ejaculate.
Okay. Yeah. I mean, the reality is in most people, they occur together, but they are two kind of separate phenomenon. But so premature ejaculation, which we, scientifically define as within 1 minute, can be caused by a lot of different things. So there are some men that are born with premature ejaculation, like their entire life, they have poor ejaculatory control. And we don't fully understand why some people are born with that. A lot of cases of premature ejaculation are acquired, and that can occur at any age. It can be related to erectile function. So men with poor erections tend to ejaculate more quickly or have poor ejaculatory control. And in those cases, if you improve the erectile function, many men will see a correction or resolution of their ejaculatory dysfunction. But beyond that, we don't really know that much about it. Not surprisingly, because of that, there are not any FDA approved treatments for premature ejaculation. So everything that we do is is off label. And the medicines that we use are meant to kind of decrease excitation, right? If you think about sexual activity and sexual function as like a balance between excitation and inhibition, then premature ejaculation would be an overly excited state, right? So we put people on medications to reduce that excitation. One of the medicines that we use is an antidepressant, which has the effect of increasing serotonin, and serotonin is an inhibitory molecule. So when you put someone on that medication, one of the known side effects is delayed ejaculation, which for the average person would not be a good thing, but for someone with premature ejaculation can be really helpful because it helps them last longer. Another medicine that we prescribe sometimes is a pain medication called tramadol, which sort of, it helps with pain because it sort of dulls the brain's perception of the external, what am I trying to say? Stimulus, yeah. Right? Yeah. And so it's doing the same thing in premature ejaculation. It's kind of dampening that excitation. And so it can help people last a little bit longer. So that's kind of premature ejaculation. There's some other stuff that you can do with people with PE, like you can, have them work with sex therapists and pelvic floor physical therapists. PT can be helpful, especially if they have a lot of spasticity or poor control, right? That can be really helpful. Sex therapy can be helpful, especially if it seems like it might be behavioral, how the person is masturbating, that kind of stuff. Working with a sex therapist can be really helpful. Delayed ejaculation is tough because delayed ejaculation happens a lot as men get older, like it increases with age. It can also be related to things like poor sensation, erectile dysfunction, sometimes hormonal factors. There's less treatment options available, I would say, for delayed ejaculation. Obviously, if you find a hormonal issue or they have ED, we can help with those things. But if it's like a sensation problem, there's not really like a prescription or a medication I can give someone to make them more sensitive. Sex therapy can be helpful with those patients too, because sometimes they don't have a problem when they're alone and masturbating. It's only a problem when they're having partnered sex. And in those cases, it a lot of times can be behavioral, because maybe they are gripping their penis way more, firmly when they're masturbating, and that sensation can't be reproduced when they're having sex with a partner. And so retraining their brain and reteaching that person to masturbate differently can sometimes help with that issue. But it can be a tough issue to address, for sure.
So you've hit it on a little bit. You've been talking about testosterone, but specifically, how does testosterone influence sexual health? Like what happens when the levels are too low?
Yeah. So when someone has low testosterone, some of the sexual issues that they can present with would be things like erectile dysfunction and low desire. I would say those are the two big ones. And so we know that improving a man's testosterone level, especially if they're below, the normal range, can often have a positive impact on their sexual function. It's also important for things like energy, and motivation and mood and anxiety. And so, all of those things are related to sexual function, right? Like if you're exhausted all the time, you're not going to want to have sex, or may have trouble engaging in sexual activity because you're just exhausted, right? If you're depressed because your testosterone is low, you are not going to want to seek out sexual activity. You may have a problem with your erections. You may not have the desire. So, improving someone's testosterone not only helps their sexual function, but helps with things like motivation, energy, and mood.
What about on like a very local level? Is it doing like specifically something for the muscles or for the blood flow?
Yeah, it can help improve blood flow, so that it can have a positive effect on erection hemodynamics. From a libido standpoint, we know testosterone receptors exist in the brain, and there's an interplay between the neurochemicals that are important for desire, things like dopamine, and serotonin, and testosterone. So I don't think it's fully fleshed out, but we know that there is a relationship between the neurochemicals that we produce and the hormones that we produce. And so that's how it can affect desire.
So what are you excited about in regards to new advancements in sexual medicine?
I think there's a lot of interesting stuff being looked at in the regenerative space, right? So not like just kind of putting a Band-Aid on whatever the problem is, right? Like if someone has poor blood flow, yes, we can put them, and often do put them, on medications to improve blood flow, but can we provide treatments that help permanently, or at least intermittently, increase blood flow? So we do shockwave therapy in my office, which has been used in Europe now for more than a decade, has been shown to improve erectile function for men. So that's exciting. There's also a lot of interest in things like other regenerative products, things like PRP, stem cells, exosomes. There's not any clinical trials that have really looked at those things specifically, but in general, those treatments are very safe, and have anecdotal reports of people reporting improvements. And we know that they have regenerative properties in other areas of medicine, right? They're used in orthopedics, it's used in dermatology, it's used to promote hair growth. Extracting and extrapolating that knowledge to sexual health seems to indicate that it would be helpful for certain men at improving things like erectile function. So I think that's kind of exciting. It's like, not only can we go beyond just putting, a Band-Aid on the problem, but can we actually resolve that issue using regenerative therapies? I think that's pretty cool.
I know it's really exciting in regards to I've just been seeing it more and more because we work with a lot of pain specialists and orthopedics, and we have a lot of patients dealing with hypermobility these days. And so all of a sudden it's like, oh my gosh, we have a treatment for this. What, like before it used to be like, I don't know, do some weights, So
Yeah.
it's a definitely exciting where things are going since I
for sure.
school. So where do you see men's sexual health evolving in the next decade?
I think there's going to be, it's just going to increase, right? Like, I think as we've talked about a couple of times, like the awareness is growing. The shame is slowly, declining, I think. And so men are not necessarily waiting to talk to their primary care providers about this problem and get referred by their PCP for these issues. They're seeking out answers themselves. So I think we're going to see an increase in the number of men seeking help for these issues. I think we're going to see an increase in younger men presenting with sexual dysfunction, who are seeking help. And I think that you're going to see an increase in the adoption of these kinds of regenerative therapies, and hopefully like more data showing their efficacy, because I do think it's a really exciting area within men's sexual health.
Yeah, and I definitely think we owe a lot to you and people like you who are really, putting this on the map and speaking out and just making it so much more approachable. Not like hiding in the dark corners. So thank you for that.
Thank you. Yeah, thank you.
Patients or providers find or learn more about you and your work.
Yeah, so I mean, as we were talking about before we started the podcast, I'm on social media at Joshua Gonzalez MD, on Instagram, TikTok, primarily, where, I'm mostly creating what I think are funny and entertaining videos about various sexual health topics. So that's an easy way to find me. I think going to my website, which is full of a bunch of different information, and talks about the services and the conditions that we treat, can be helpful for patients. That's just joshuagonzalezmd.com. They can also reach out to my office and schedule an appointment. We see patients obviously in person, but also offer virtual consultations for patients that may not live locally in Los Angeles, and may find it difficult to see our office. Some of this stuff, does require, as I mentioned, if you're someone that needs a penile Doppler, that's not something that we can do virtually, but we can always start virtual and decide whether or not it would benefit that person to be seen in person. But a lot of the initial intake stuff can be done virtually. Yeah. And so I think that those are the kind of easiest ways to find me and learn more about me and kind of what we do here.
Well, thank you so much. I mean, we're approaching, the hour at this point, and I really appreciate you talking with us. This has been really delightful. I've learned a lot. I hope our viewers and our listeners have learned a lot as well. But if they want to find out more about sexual health topics, so pelvic floor, physical therapy, we might be following this podcast, which is Pelvic Messenger. We also have a social media account at Beyond Basics PT, where we also try to debunk some of these myths and stigmas related to pelvic pain and pelvic health. And we also have a website at www.beyondbasicsphysicaltherapy.com, which is a mouthful. I also think beyondbasicspt.com also works. So for
Nice.
more insight and conversations about all things pelvic health. But thank you again for joining us. Again, really enjoyed.
Yeah. Thanks for having me.
Yeah. And until next time.
Awesome. Bye, everyone.